staying only within clinical medicine would never change the structure of healthcare. Simply pointing out the program or proposing solution isn't enough. Without experience or track record, ideas are rarely taken seriously.
Welcome back to Rerouted, where we explore unique career paths to give you the tools you need to create the life you want. Today, I talk with Fuyuto Miyake, a residence physician based in Japan. In addition to his clinical work, Fuyuto is focused on designing AI tools to improve healthcare systems around the world. We talk everything from how he learned the skills to win a 4,000 attendee hackathon, to projects he's working on right now, to what his vision for the future of AI in healthcare looks like. Let's get into it. Fuyuto, thank you so much for joining me today. It's really great to have you here.
Yeah, thank you for having me.
All right, I want to start by asking you, briefly, what do you do for work?
I am a junior resident physician, large hospital in Japan, where I'm rotated through different departments like internal medicine, emergency care, pediatrics, and anesthesiology. In Japan, doctor have to rotate a lot of departments in 2 years, and after that, we can decide any department we'd like to go. So this is my just a resident physician. And alongside my clinical work, I design a prototype AI tool focus on healthcare operation, triage, and public health, aiming to bridge frontline medicine, technology, and policy.
All right, awesome. So, what led you to become a doctor?
Yeah, good question. One thing that influenced me the most was my grandfather, who was a community physician in a small town. He was always focused on how to help the patient in front of him, and through that dedication, he earned deep trust from many patients. Seeing how much respect he earned and how closely he was connected to people's lives made me want to become a doctor from a young age.
You mentioned that in addition to your clinical work, right now you're also doing some AI projects. So, what got you interested in software and AI?
In hospitals, I continuously felt the gap. What should happen and what actually happened. Growing up influenced by my grandfather, I believed that if a doctor truly dedicated themselves to the patient in front of them, good medicine would naturally follow. But when I started working in a large hospital, I realized there are many structural problems that made it hard to fully focus on each individual patient. A very concrete example comes from the emergency department. A patient with minor injury can work indirectly, especially during infectious disease outbreak or at night when clinics are closed, and they come in large numbers. At the same time, ambulances keep arriving non-stop. With a limited number of doctors, we have to see everyone. In that chaos, the biggest risk is missing a truly severe patient hidden among many mild care. This overcrowded isn't just a problem of individual doctors, it's a structural problem of the regional healthcare system. That frustration made me interested in programming AI because as a doctor, all I can do is treat the patient in front of me. I can't change the structure. That's frustration. I felt that technology might help fix the system itself, not just treat one patient at a time.
Your education is in medicine. How did you start to learn how to code and how to use different AI tools and implement AI to be able to help hospitals?
I started by having conversation with ChatGPT. Before that, learning programming means searching the internet or reading books or trying to find examples similar to what I want to build. And that search itself took a lot of time and energy. In the AI era, the cost of searching for knowledge is almost zero. You can ask exactly what you want to know in your own word at the moment you need it. So instead of starting from theory, I first imagined what I want to build. Then I learned by asking ChatGPT questions step by step while actually building. For me, this was the most efficient way to learn, learning driven by creation.
Would you recommend a similar approach like that to somebody else who's looking to start building tools?
Someone who want to create application and with no technical skill, I recommend them to use just ChatGPT. And I think the most important thing is having curiosity to solve the problem, a specific problem related to their work or their hobbies or others, their interests. First, having curiosity to solve the problem, and after that, speak with ChatGPT. This is the best way, I think.
That's very approachable for anyone just starting off. I want you to tell me about you entered a hackathon in Dubai. Can you tell me a bit about that?
I joined the hackathon in Dubai with 4,000 person. I I created Triage, healthcare triage application. Triage is a kind of a prioritization of patient treatment, and it is very important uh, in like emergency department uh, or disaster environment. In this situation, there's scarce healthcare provider for the resource is limited. So the prioritization is very, very important. And like I said, the a crowded emergency department, it's a program, and to solve this program, to solve the serious patient in crowded emergency department, the triage is very important. With my application, we can just triage by taking a movie in 10 seconds with smartphone. This smartphone gathers some biomarkers like pulse rate or others. And a lot of these data move on to the backend agent, which agent can triage the patient in front of me. I joined the hackathon as a way to prove result. I had a strong belief that staying only within clinical medicine will never change the structure of healthcare. Simply pointed out program or proposing solution isn't enough. Without experience or track record, ideas are rarely taken seriously. A hackathon was an opportunity to demonstrate my ability to design meaningful programs and actually important solutions. So that's why I joined this. Not to learn quietly, but to show my ideas. This is my main reason to participate in hackathon.
It's really impressive as well because I know that you ended up winning that hackathon. After you won, you ended up posting about it on LinkedIn and X, and you got a lot of engagement. I think I saw you had almost like 500,000 impressions on X. So I'm curious, did you see any benefits to having your posts about winning go kind of viral and having your success out there online?
Yeah, yeah, it's very great question, I think. Yeah, the short answer, yes, absolutely. I share the result both Japanese and English. In Japanese alone, the posts reached around, as you said, 500,000 impression and received about 5,000 like on X. On major profit was that it connected me with people I'd never interacted with before, founder of AI startup, venture capitalists, and investors, not only with medical professional, but also these business person. By discussing my gap and the real challenges I see in clinical practice, I was able to shape my thinking and gain much clearer insight into the program I want to work on. Another important benefit was the reaction from people who are already close to me. I think this is maybe I have not expected this, but I think this is the most influence for me. Mentors I deeply respect, colleagues, and even juniors started to reaching out and saying things like, if it's about AI in healthcare, you are the person to talk to you. Talk to me. Talk to whom? So that allows me to give back to people who had supported me while also being introduced to many new connections. This reminds me of something Elon Musk once said, that the biggest value of school isn't knowledge itself, but human connections, and that those connections become long-term assets. Yeah, I agree with their ideas, and sharing my result publicly helped me build relationships, inspiration, and new career possibility. And this connection is the most important things in this area, I believe.
Can you give me an example of what an interaction looked like between you and then you mentioned of like venture capital as well? I'm curious what that interaction looked like, especially because you didn't have a full-fledged startup. It was you won a hackathon. So I'm curious about what that interaction was like.
Before I start talking with this business person, I'm not sure that how my product split all over the world. and implement the uh, or implement my product or solution to all over the world. I am an expert in healthcare, so I have a lot of pains, and yeah, I have a lot of ideas to solve these problems. But it is very difficult to spread and implement this idea to the real world, because if I can implement my application to my hospital, but to spread all over the world, all over the hospital, the more skills is needed, like business or motivation to implement this application. So in terms of implementation, the conversation with a venture capitalist or other business person, it's inspiring. It was influenced me a lot.
Have you started implementing it in your own hospital or other hospitals in different places?
No, not yet.
I want to take a second and I want to zoom out to the timeline of the chain of events that's happened here. Because I know that it's all really, really recent. When was the hackathon? It was a few months ago, no? You're just starting all of this, like you mentioned. So I want to take a second and just zoom back and say, oh, this is all really new. And even as well for finishing medical school, when was that? When did you finish medical school and start your resident program?
Okay. Yeah. Uh, I I graduated from medical school, uh, 2024. So just
Okay,
two years ago. I'm just a second year medical resident. Yeah.
yeah. That's really interesting and impressive to me how you graduated med school 2024. Couldn't have been too much later. Start dabbling in these tools and then winning this hackathon. I think that it also is very interesting to me since you're somebody who is relatively new as a doctor, you're able to see the systems in place and not take them as just this is how things are, but I'm somebody who can change these systems because I don't like dealing with these. I haven't been dealing with them for 10, 20 years. I just had to deal with it for the first few times 2 weeks ago, and it really sucked. I think that you come from an interesting perspective of being able to see where different processes that AI can be implemented in to create new apps. So I just wanted to say that. I think that's really cool. Yeah.
Oh, thank you so much.
Yeah, of course. So I'm curious now. We were connected through somebody that you've done some work with through a startup called Virify. So I'm curious, can you tell me a bit about your work with Virify and then other projects as well that you're working on?
Okay. Yeah. I I'd like to talk a lot about
Okay,
these things, because
perfect.
my passion is focusing on this project. So
Hmm.
yeah, I'm currently involved with Verify, like you said. This is a non-profit organization based in California that uses smartphone-based audio analysis to detect respiratory disease such as COVID-19, influenza, or asthma, and so on. I joined Verify around September last year. So just I have joined for 3 months, 3 or 4 months.
Mm-hmm.
Uh, my role so far has focused on my market research, reviewing and refining document, and providing UI UX feedback from clinical perspective. I've also proposed ways to improve internal workflow using AI to increase efficiency. And going forward, I plan to become more involved on the development side as well. And yeah, the purpose I'm joining this organization is that the main reason is that I'd like to learn how to implement this application to the real world. And the second reason is that it is connection with all over the world. Because in Purify, technician and clinician are joining, like from the US or like from Dubai or Saudi Arabia or Japan or yeah, and so on. And so the interaction between a lot of all over the world is also inspiring. This is about Verify. And yeah, my project, I have more projects on my own. My main project Right now, it's what I call a city OS project. The city OS project is a kind of gathering data of the residents in area, and we can process this data and try to improve the healthcare in the city, improve the decreasing in the rural area with technology. And this is a collaborative research effort in a region of Japan that has actively invested in digital infrastructure since the recovery period after Japan's big earthquake about a decade ago.
Hmm.
Yeah, and in this region, as I said, data such hospital patient, regional API, and records of residents, daily activity can be secured, controlled, and reused. By building on this foundation, my goal is to use AI to promote the health of people working in the community. So what excites me about this project is that it allows me to address problems I see as a hospital physician, issues that cannot be solved inside hospitals alone by approaching them from a community and system perspective. Ultimately, I'd like to explore how individual level data can drive behavior change, improve healthcare outcomes, and even revitalize local economies. I believe this kind of work can help create an environment where healthcare workers can find meaning and sustainability in their work using data, AI, and behavioral insight beyond the hospital wall. That's my project I'm focusing on personally.
All right. I'm curious, you've got your time split between a few different things. How do you manage
Mhm.
it and how do you set your priorities at any given time?
Yeah, this is also a great question. Many people say to me, I'm very busy and yeah, how I can manage like my priority. Yeah, first, first of all, I try, I make sure to create my time. For example, now I'm living in my hospital,
Hmm. Okay.
because it is more efficient for me to work because I'm living in a hospital. So I oh, woke up in hospital and I can easily go to my office about just
Mm-hmm.
10 seconds. So, and I started working with personal computer in office and to check my patient. And after my work, uh, I can start my work as an engineer as soon as possible. And also, I don't have to take off trash because a hospital clerk take this trash out. And my clothes, I also don't have to, don't have to wash my clothes
Mm-hmm.
because hospital treat and prepare my clothes. I think this is the most important things to create the time.
Really, I don't think I've ever met anyone who lives where they work and has their trash taken out and their laundry done by also where they work. So that is pretty awesome of a setup, I will say. Um, and I think it goes to show just the even if it's not big things that you're kind of eliminating, it's the small things that add up a little bit. Like you've cut out you were saying you have 10 seconds between when you leave where you live to your desk and then also to just being able to not do laundry. I mean, yeah, cutting out some of the little things or just trying to shorten the dead time where you're not doing work. I really like that approach. A little bit ago, you did a program at Harvard, the International Health Systems Program. I'm curious, what led to that and what did you gain out of it?
Uh, yeah. Okay, first, let me explain briefly about the Harvard International Health System program at Harvard. It was just a 1 week intensive program, and I was introduced to it by someone I happen to know, and what immediately caught my interest was the opportunity to think beyond what I can be solved inside the hospitals. I want to
Hmm.
explore what kind of approaches exist to tackle healthcare programs that frontline medicine alone cannot fix, and how AI could contribute to public health and community-based care. Most importantly, I want to discuss these questions with faculty at Harvard University who are working at the forefront of global health system. And I joined the program without knowing anyone there, but it turned out to be a turning point. What I learned and the connection I made had a direct impact on my current work. Like I met people connected to Verify during this program, which eventually led me to start my internship there. Also, I met collaborators who later become a partner in my ongoing CTOS project. And that experience really taught me that you never know which encounter will shape your future.
All right. Very cool. And now I'm interested, you mentioned this at the very beginning of our conversation about policy. So I'm curious, how does your policy interest tie into AI and medicine? And it seems like you're, I won't say a pro, but pretty much a pro at the medicine and the AI part. But I want to know about how that policy part ties in for you as well.
A policy is a missing link between good idea and real impact.
Mm-hmm.
Yeah,
Okay.
working as a physician, I've learned that many of the biggest programs in healthcare cannot be solved by clinical effort or technology alone. This is my first motivation. Even if an AI tool is accurate and well designed, it won't be used unless it fit, fits within regulation, incentive, and existing healthcare system. That's why my interest in AI naturally led me to policy.
As somebody who is a practicing physician and who's also working on AI projects, mostly around medicine, what do you think the vision is for AI in medicine going into the future?
Yeah, a very good question. And this is a recent topic. First, I'd like to introduce. Recently, Elon Musk has said that within a few years, surgical robot may outperform human surgeons. And
Hmm.
also, today, OpenAI has announced new healthcare-focused model called ChatGPT. This is the latest topic. I think over the next few years, medical AI will advance very rapidly. Many technologies that were previously confined to research are now reaching the stage of real-world implementation, validation, and deployment. In the future, I envision AI enables patients to continuously make personalized health optimized decisions in the daily lives. At the same time, advances in surgery and new drug development will dramatically expand the range of treatable diseases. It's even possible that dying from preventable illness become increasingly rare. If that happens, the central question of healthcare will shift. It won't be only about treating disease, but about how people live fulfilling and meaningful lives. That's why I believe the future of medicine must extend beyond hospital. This concept, social capital, is a kind of human connection, trust, and environment that support well-being. I learned this concept from the Harvard Medical School program, as I said, and
Mhm.
I think we'll need to design community from perspective of social capital, not just medical intervention alone. In conclusion, my vision is that AI handles optimization and prevention while humans focus on care, relationship, and building society where people trust can truly thrive. Yeah.
So now that we've entered 2026, there's a lot happening now more than ever for you, which I have to imagine is really exciting. But I'm
Yeah.
curious, what types of opportunities might you be looking for, or are you excited to continue really focusing down on as we come into 2026?
Yeah, great question. This is the most interesting question. Well, first of all, I'm not sure what will happen in 2026 because I think the development of AI in 2025, the advance has been rapid, so rapid.
Mhm. Mhm.
Yeah, you know. But yeah, in terms of 2024 interest, it is the opportunity to connect healthcare with city-level system in an aging society. In Japan, rapid aging is one of the most pressing challenge. Through the City OS project I introduced before, I want to link medical data, AI, and community-level system to promote population health and help build a sustainability city. My goal is to take on this challenge from the combined perspective of medicine and AI, not just improving healthcare delivery, but redesigning how cities support healthy living as a whole. So if
Mm.
you can build a working model in Japan, I believe it can become a blueprint for a sustainable healthcare system globally. So that's why I'm excited about the possibility of creating something locally grounded, yet globally applicable, and contributing to international health system through that work.
I hope you enjoyed the episode. If you have any thoughts, feedback, guest recommendations, or just want to say hi, shoot me an email at nick@reroutedpod.com. If you like the show, leave a review, give us a follow, like, and subscribe. You can find links to our websites and socials in the description below. You can also find the links to Fuyuto's X and LinkedIn profiles in the description. I'm looking forward to seeing you next week.